Hello, everyone. My name is Alison Ayadi, and I'm a perinatal social epidemiologist and implementation scientist at the University of California, San Francisco. I'm delighted to be presenting my leadership project to you today, identifying opportunities for the prevention of adverse outcomes following female genital fistula repair, a gendered lens. My research mission is to carry out innovative epidemiologic research on the structural, social, and interpersonal factors influencing maternal health disparities, and translate this research into tangible approaches for the prevention and treatment of maternal morbidity and mortality informed by a social justice and equity perspective. I conduct observational and interventional research focused on improving perinatal care quality and access. My work in global maternal health and my leadership project are inspired by my professional and personal experiences with maternal health and equity. Maternal mortality, and by extension, maternal morbidity, remains one of the largest health disparities between low and high resource settings, and within countries, significant disparities exist across indicators of social status. Female genital fistula is a preventable maternal morbidity which can occur in the absence of high-quality emergency obstetric care. Global surgical access has greatly increased over the past decades due to fistula surgical training initiatives and dedicated clinicians. However, even women with successful surgery can face adverse post-repair risks. Developing the evidence base on predictors of adverse post-fistula repair outcomes can inform intervention development to mitigate complications, improve post-surgical outcomes, and improve quality of life. My leadership project is nested within an NIH-funded mixed methods longitudinal cohort study in collaboration with researchers across Uganda and Kenya. In this project, we seek to identify incidence and risk factors of post-repair fistula breakdown and recurrence, incidence and risk factors of post-repair incontinence, and to generate feasible and acceptable strategies for modifying key risk factors. For my leadership project, I'm incorporating a gendered lens into this biomedical research study. Explicit gender integration is key for this project because the causes and consequences of fistula are very strongly influenced by gender, because in the post-repair period, women's agency for adhering to post-repair medical guidelines is also structured by gender, and fistula surgical care is male-dominated, whereas other fistula caregivers, including nurses and family members, are largely females. During this process, I am prioritizing the voices of key stakeholders, women with fistula, family caregivers, and fistula nurses, within my research to develop and implement a clinical and social empowerment strategy for optimizing women's post-repair health. My leadership journey goal is to create a feasible, acceptable, and impactful intervention to mitigate key post-repair risk factors through a stakeholder-engaged collaborative process incorporating a gendered lens. Then develop a research proposal and protocol to test the intervention. This process involves several steps, as you can see here. First, conducting the analysis of our cohort data to generate quantitative evidence on the risk factors and experiences of adverse post-repair outcomes, as well as qualitative analysis of our in-depth interviews for a more nuanced understanding of experiences and contributors. Next, we are interpreting and validating these findings with diverse study team members in an iterative fashion. Finally, we're conducting a multi-day human-centered design process to review the findings on risk factors of adverse outcomes, detail all potential intervention strategies for addressing risk factors, identify multi-level facilitators and barriers to intervention strategy implementation, and success. All of this with purposively selected participants, including women with history of fistula from our longitudinal cohort study, family caregivers, and fistula nurses. Finally, we will create a consolidated intervention plan based on our human-centered design work, and we'll develop a research proposal and protocol to test feasibility, acceptability, and preliminary effectiveness of the intervention. As you can see by the blue line, my team has made progress on the initial steps of the plan, and we anticipate being able to complete the full human-centered design process later this year. Over the past year, the leadership journey with WomenLift Health has truly been a transformative learning experience. It has both challenged me and supported me beyond what I had expected. I'm so grateful to all of the program staff, my cohort members, and my mentorship group for everything. Participating in this program has given me a strong understanding of what authentic, inclusive, strategic, and impactful leadership looks like, and has helped me to conceptualize my own leadership style and goals. It's also helped me to develop a vision, increase my confidence in using my voice and presence, and informed areas where I can step back. It's helped me identify key areas for self-growth and find resources for facilitating that growth. And it has given me concrete skills for improving my mentorship. As I move on from this intensive year, I look forward to continuing to reflect on my learnings, expanding the skills that I've gained, and continue my connection with the incredible WomenLift Health family. Thank you so much for your time and attention.